我哋而家有請德國聯邦藥物與醫療器械所輔助及替代醫藥與傳統藥物部主管 Werner KNÖSS 教授為我哋分享一下中藥產品同歐盟規管框架嘅現況。Ladies and gentlemen, now let's welcome Professor Werner KNÖSS to share with us the topic, Chinese medicines, products, and the European Union regulatory framework. Professor KNÖSS is the head and also of the Department of Complementary and Alternative Medicines and Traditional Medicinal Products at Federal Institute of Drugs and Medical Devices in Germany. Professor KNÖSS, please.
Good afternoon, ladies and gentlemen. I would like to thank the organizers for inviting me to this great conference. And it's really an honor for me to be here and to have the opportunity to learn so much about Chinese medicines. So looking at this title, of course, I will also talk a little bit about Chinese medicines, but especially on the way how they do fit into the European regulatory framework. So this morning we had the pleasure to listen to Dr. Lam and Dr. Wang about the situation in Hong Kong and in mainland China. And I'm always glad to hear that the regulators all over the world have the same challenges, the same problems. And so I think it's really like Dr. Wang pointed out, it's good to listen, to hear, to communicate, and to draw conclusions what may be done best for traditional medicines all over the world. In Germany, we have a special acceptance for any kind of natural medicines. It was mentioned this morning by Professor Sang. And so as he was talking about the irritable bowel syndrome, I can tell you in Germany, we have one of the most popular remedies for bowel diseases is a herbal product, which is composed of 9 different medicinal plants. So we face the challenges, we have similar problems, but maybe we can together look for rather good solutions. This is just a disclaimer to get at least my work not cited on behalf of EMA, but I will talk about EMA and the HMPC later. Of course, I do the best and give the best information I can give to you. I will first give you an insight in the legislation on traditional and herbal medicinal products in the European Union, and then try to give you an impression on how we try to harmonize the different regulatory frameworks in the European Union. And then I will show you which kind of options are currently existing for traditional medicines of non-European origin within this framework. And finally, I will come up with some conclusions. Traditional medicines have developed and have been used all over the world. In any continent worldwide, traditional medicines have been used, and they have been used like here in China some 1,000 years ago. No regulators were existing at that time, but of course times are changing, and from this ancient usage of medicinal plants worldwide, we are now in a decade, in a century, where we are trying also to safeguard the public health and to provide products which have a quality, which have an efficacy, and also where we know most, at least as possible, about the safety. In the European Union, we have a political union of 28 member states with about 500 million inhabitants, and there are 24 different official languages. And in the same way, we have also, even in small Europe, different traditions with herbal remedies, how to use them, how to apply them to children. And so it's one of the challenges we are facing, that we try to harmonize the legislation between all the European Union member states. And on one hand, we had a rather basic law which was dealing with medicinal products, these kind of finished medicinal products I will also talking about. This was the so-called CD, standing for Community Directive 2001-83, which was a basic regulation on medicinal products in the European Union. This second, which is mentioned here, the Annex 1 with the Common Technical Document, CTD, is defining criteria in general for the market access of medicinal products. But it was realized that if for traditional medicines you should follow all the requirements which are valid for all the medicinal products, also including chemical products, then we run into a problem, because for many of the traditional products the data are not sufficient, or they are existing in a different way. And therefore the European Union created this Community Directive 2004-24, which was especially dealing with traditional herbal medicinal products. So we have a kind of set of definitions which is laid down in this legislation, which is referring to the medicinal products, which is referring to the herbal medicinal product, to the traditional herbal medicinal product, herbal substances, and herbal preparations. I will not go, due to reason of time, into detail, but I think it's important to be aware that all over the world we have different definitions in different continents. But I was rather glad when I listened to Dr. Lam this morning, because the definitions he presented for these Chinese proprietary medicines was not that far away. There are slight differences, but in general it's not completely different. And so this is the basics that we have to understand. In each region or on each continent, in some countries, we have distinct legislations. And of course, one of the major tasks of the regulators for the future will be to communicate and to bring together these definitions. Looking at the European Union, we must also be aware that this is a very complex political framework where we have different key institutions. One is, of course, the European Commission and the European Parliament. They do the basic regulatory framework, the law, with directives and regulations which are then valid for all the European Union. We have national authorities like the Federal Institute in Germany, where I'm working, where we do most of the assessment, where we release marketing authorizations on different kind of procedural ways. We have the European Medicines Agency, the EMA, which is doing the coordination within this network, giving guidance, and there in some specified circumstances is a chance for a centralized procedure which end up with a license for all over the European Union. But this is not affecting the herbal medicinal products I will talk about today. And last but not least, we have the European Pharmacopoeia, which is defining quality standards, some generals, but also special standards dedicated to herbal drugs and herbal preparations. So within these key institutions, we just want to focus on some of the tasks which are related to my work and also to the globalization of traditional medicines. We have the European Medicines Agency, which is releasing monographs by the work of the HMPC, the Committee on Herbal Medicinal Products, which are dedicated to safety and efficacy of herbal substances. We have another set of standards which is set by the European Pharmacopoeia, where the monographs are just describing quality issues. So to understand this, you must just believe for the European monograph system, we have two different institutions setting the standards, whereas in China, in the Chinese Pharmacopoeia, we address as well quality as efficacy and safety. But then to come into the market, you need an application to a national competent authority or to the European Medicines Agency. And then after an application has been filed, there is an assessment and maybe filing a license. At the right bottom of the place, this is a picture just of the Federal Institute in Bonn, where I'm working. For the access to the market, looking at herbal medicinal products, there are different options and concepts which are offered in the European regulatory framework. You can file a full application, for example, for new medicinal products, and these are more or less the same requirements as the requirements are also for chemical entities. But we have another concept which is called the well-established use, which must be used within a medicinal environment of a finished medicinal product licensed in the European Union. And we have a third option, this is a registration, which is linked to a traditional use of a product. So first I will give you a little bit more insight into the well-established use and the traditional use concept, but this does not mean that we are completely neglecting this full application, because my question to scientists at universities, to developers at the industry is always, yes, you may also consider to go this way of a full application. You can get together all the data and then came up at the end with the same status like a chemical entity. Looking at these more specific concepts for the well-established use, there must be, for more than 10 years, an accepted medicinal use in the European Union based on a marketing authorization. There must be a quantitative substantiation of the use of such a substance. There must be a reasonable degree of scientific interest in the use of the substance. You should have publications, you should have literature, maybe also textbooks which are covering this. And there must be a coherence of all these bibliographic scientific data and assessments and published literature. And finally, for the HMPC monographs, where we also can dedicate such a well-established use, there must be at least one controlled clinical trial of good quality. So as this scheme is just depending on 10 years of marketing authorization in the European Union, this option is not really suitable for products which are now handled in China as herbal medicinal products, because they probably will not have such an authorization so far in the European Union. But the other option is quite interesting. This is the option of traditional use. There is in the European law this specific option dedicated to traditional herbal medicinal products, and there we need mainly 30 years of medicinal use within the European Union. This can be just merely a traditional use, not linked to a license, but it could also be 15 years within the European Union and 50 years outside of the European Union. It is still often said that this is, for example, a block to Chinese medicines, but I think this is not true. On one hand, there is a deviation possible, which may be decided by the Committee on Herbal Medicinal Products if requested by a European Union member state. But secondly, of course, we have a lot of Chinese communities. We have TCM hospitals in the European Union. And so it could be possible for at least some Chinese medicines to trace this use of 15 years within the European Union. Nevertheless, to safeguard public health, this specific concept where really the proof of efficacy and safety is reduced to the tradition, there are some provisions which are necessary to safeguard public health. The indications must be appropriate. Mostly these are minor diseases, because these products must be used without supervision of a medical practitioner for diagnosis, prescription, or monitoring or treatment. They are only for oral external use or for inhalation. There must be sufficient data on this traditional use, and there should be a plausibility of the pharmacological effects based on the long-standing use and experience. So it's really a category which is dedicated to this long-standing use, to the experience, but there are some limitations. If you look at the diagnosis, which is made in traditional Chinese medicine to get an individual prescription, this is a different approach. But we are talking about these kind of proprietary medicines, which were also in the focus of Dr. Lam this morning. If we look at the requirements for these different three options, then we do not go into any detail of this slide, but you see that we have three categories: the new ones, like the full application, well-established, and traditional. For the quality, there are the requirements always the same. So there are no difference on the quality control, starting with good agricultural and collection practices, good manufacturing practices, and quality control done for the product. So in this way, I think this is also in agreement with the presentation given by Dr. Wang, where he also pointed out the same requirements in the field of quality. For safety and efficacy, you need new tests and new trials for these new products, but in the well-established scheme, you have bibliographic data which should be available, and especially for the traditional scheme, there may be expert reports and bibliographic data. There is the traditional use, and so in this case, we rely on the traditional use as a proof of efficacy. No clinical trial is necessary. Of course, it would be welcome and it is not excluded, but it's not obligatory. And for consumer information, labeling, advertising, and pharmacovigilance, still all the requirements are the same. In this way, the licensing has just two different categories. One is the marketing authorization, and the other one, the registration, but all these three types are representing a valid and legal access to the market for finished medicinal products. So let us have a look on the role of this Committee on Herbal Medicinal Products, which is one of 7 committees at the EMA. Just to have a look at the people, it's consisting of experts from all the member states, and this picture was taken just during a recently presidency meeting we had in 2015. And there we just can give you an insight that these are some 30 to 40 people who are working on this harmonization within the European Union. The European Medicines Agency is located at the River Thames in London and is a central European authority with the task of coordinating the network of the national competent authorities. It's composed of committees and working parties gathered together by experts from all over Europe, but also, of course, of permanent staff there in London. And the documents which are established wherever in the framework of the task of the EMA are usually published at the website under www.ema.europa.eu. So there are 7 committees, 7 scientific committees at the EMA, and one of these committees is the Committee on Herbal Medicinal Products. This committee is composed of 28 members, 1 delegate per member state. Each delegate has the same vote. We have 2 extra members from Norway and Iceland who are in the European Free Trade Zone. And we have additionally up to 5 co-opted members who are representing specific fields of expertise like pediatrics, toxicology, general medicine, and so on. The picture is just giving you an impression that, of course, on the one hand, if you have such a committee to harmonize the different perspectives within the European Union on herbal medicinal products, it's a great challenge, but also a chance because many different disciplines are involved. We have physicians, we have pharmacists, there are people from the university, toxicologists who are members of this committee. I have the pleasure to chair this committee since 2010, and so what we do is to try to harmonize the different traditions we had across the European Union, and since 10 years, since 2004, following these Directive 2004 and 24. The pictures just shall give you an impression about the different traditions with herbal medicines across the European Union, where we may have, like in Germany, with the red sign A for pharmacy, Apotheke in German, but you may also have local markets with some herbal teas and a great mixture of different standards and different traditions. The work of the HMPC was then dedicated to harmonize all these different standards by releasing at the end European Union monographs on safety and efficacy, and as well as a second part to release guidance documents which should make the system overall fit for the purpose. The HMPC is developing a different set of documents. So you can see the most important task is development of these community monographs, which are strong recommendations to the member states. We have even a second option, so-called list entries, which are published by the European Commission and which are binding to the member states. Public statements are released when specific information for monographs is missing or there is a concern, for example, with toxicology on a distinct herbal substance. We try to make the system sustainable, and therefore we want to revise these monographs every 5 years to bring them to the current state of the art. The HMPC releases guidelines which are recommendations to national competent authorities and applicants, and they represent a consensus on a harmonized assessment, for example, of quality items like stability or about the labeling. And finally, we have reflection papers and question and answers when we want to publish regulatory perspectives on selected topics. Achievements over the past years: about 140 of the monographs, 13 list entries, 16 revisions already done, and 13 public statements, about 30 different guidance documents. And all these standards are available to the public. I already mentioned the website of the EMA. We publish the agendas, meeting reports, and minutes of the HMPC meetings, so everyone in the world can follow what's going on there. We publish the monographs, but not only the monograph text. We publish together the assessment report, references, and also comments which were made by interested parties or the public. And so the same for the guidelines. Everything is available and can be seen, discussed, and is rather transparent. If you look at the therapeutic areas of these traditional herbal medicinal products, where we have meanwhile during the last 10 years more than 1,500 of such registrations all over the European Union. These are covering, for example, therapeutic areas like cough and cold, mental stress and mood disorders, gastrointestinal disorders, urinary tract and gynecology disorders, sleep disorders and insomnia and others. So just a very typical spectrum, at least for European Union, of this kind of traditional use of these products. And especially without going into the figures in detail, if you see, you have the dark blue bars, which are standing for monocomponent products. The light blue bars are standing for combination products. And this gives you an impression that nearly 35 to 40% of these products are combination products. So we are dealing with combination products, and they are also a part of our system. Within the monographs, we also ask for input on data, and here just the examples to show this interaction with the public. So we are open, and I will show you later that we are also having some pilot projects with traditional Chinese medicines, and we hope to get more such data also for these kind of documents. There are different parts in our procedure where there are options for input of data. There's a call for data before the start of the work, a public consultation after finalization of a draft monograph, and there we want to have support by interested parties when it is scientifically based and justified, and also including supporting documents. For the last part, I will give you now some flashlights on the way the HMPC targeted the options for traditional medicine of non-European origin during the last years. Just a short look at Germany, for example, related to TCM, which is not really representative for the European Union because the situation currently may differ from member state to member state. But there are pharmacies in Germany making a network which is offering about 200 to 250 herbal drugs from traditional Chinese medicine. These are certified and they are delivered on prescription by TCM healthcare professionals. In some other member states, they may be available in herbalist shop, But also in Germany, we have some specialized hospitals which are specialized either on traditional Chinese medicine, but as well on natural medicine in general, and maybe then applying also traditional Chinese medicine. Of course, some of these products are also offered via the internet in a rather uncontrolled environment, and they may be sold sometimes with different classifications as food or sometimes as cosmetics. So there is still a need for further harmonization in the European Union. On the work program of the HMPC, we had 2 items over the last 4 years, which were especially following these complex questions addressing the non-European therapeutic medicines like TCM. We initiated a pilot project for herbal substances with a non-European traditional background. So there were 3 or are still underway, 3 monographs for herbal substances from the traditional Chinese medicine. And we want to identify central questions or obstacles and provide specific information, also in conjunction with the training for the assessors. And we want to harmonize the assessment practice so that all over the European Union we have a similar approach in assessing these kind of medicines. We started already in 2011 when a delegation of the HMPC visited in Beijing and gave a seminar to industry explaining the European legislation and the monographs approach, but we had also meetings with other authorities, like here with the Chinese Pharmacopoeia, but we met also at that time colleagues from the Chinese FDA. In 2012, we had an assessors training, so the members of the HMPC were trained with specific presentations on traditional Chinese medicine and at least should get more detailed view into this topic. In 2013, we started with a pilot project on monographs for herbal substances from traditional medicines of non-European origin. And in 2014, we released a document which was a question and answer document, especially addressing the problems but also the options within the legislation referring to non-traditional to non-European traditional medicines. This document I cannot go into detail, but it's recommended to have a look at it for all those people who have a more detailed interest in the European legislation, and we tried our best to have in focus those questions which are important for those people who are considering to bring a product to the European market, which then will have to follow the European legislation. So there are different parts addressed, like quality, like what are advice procedures which are available, and this knowledge is quite worthwhile to look at in this context. The experiences so far, especially with the pilot project on monographs, were not that convincing at the moment. We did not get sufficient data to support the well-established use, which is not really astonishing. As I said, there were no marketing authorizations so far in the European Union, but there was also a problem to support the tradition of 15 plus 15 years. We ourselves do not completely believe in this result, and this may be still a problem of communication, of translation, of existing literature. I'm convinced that this problem can be overcome, and it's not that we do not accept the tradition which is existing, but it's just the idea and the way how to transfer a tradition to the European Union. Especially if you look in the traditional Chinese medicine, you may have an indication which is linked to an increase or a decrease in the Qi. And of course, this is not known in the terminology of the indications in Europe, and we have to get the right translation, the right communication to make a transfer for this finished medicinal product. But also the data on posology were not always sufficient, and neither data on safety and plausibility. But therefore, we identified as a future task that we search for strategies and solutions, and a part of this will be to have contact with authorities or other institutions in China to exchange more and better data and to overcome these obstacles. But if we summarize on this option for traditional medicine from non-European countries to Europe, basically an access to the European market for finished herbal medicinal products is possible according to the European legislation. There must be requirements fulfilled. The options are either mainly the traditional use, or you could go into the direction of a full application with a full set of development. There are different procedures addressing either a national market. By a decentralized procedure, you could address different member states at the same application, and in some exceptional cases, you could go for a centralized procedure. We have two examples so far that this way is possible, and for two products, there were successful applications to end up as a traditional herbal medicinal products license, the one in the Netherlands and the other in the UK. It's of course a very limited number of examples, but this show when the strategy is professional, then you can have success. And part of the professional strategy includes, of course, the availability of resources. Someone who wants to enter this market must be willing to invest. You need sound data and adequate documentation in accordance with the European legislatory framework. And our major recommendation is to seek early scientific advice, which is offered either by the national competent authorities in the European Union or by the EMA. So for everyone who wants to really get access to the market, I think this is a must to get in contact with the authorities and then to discuss about a project and to get to an idea how far this will be possible. This brings me to the conclusions. The HMPC has developed harmonized European standards for the member states of the European Union. The European legal framework offers options for traditional herbal medicinal products from non-European countries, and we saw two examples from the traditional Chinese medicines. There are, I want also to mention, of course, limitations. Our legislation does not allow, for example, material of animal origin, but it could be possible to include vitamins or minerals in traditional herbal medicinal products. This would be possible. But we have then to look in detail for a specific project what's possible. The HMPC has followed different approaches to strive for harmonized assessment of traditional herbal medicinal products from non-European countries. We are really at the beginning of a very long road, but I think we have to go along this road and in terms of globalization have to communicate really about the globalization of traditional medicines as such. Scientific advice is offered, I can only emphasize it, and professional applications are welcome. And there is a need for the communication amongst regulators at a global level, which is developing. But I think after 5,000 years of usage of traditional medicines, we need also some patience to develop this communication, to find global solutions and to go ahead with this. And it's not only about the regulators. I'm personally very convinced that the scientific community must also be a part of this development, because always there is a gap of data, and we need at least to decrease these gaps in order to overcome always the fear of the regulators that there are not enough data on safety and efficacy and quality. And I hope my presentation will contribute a little, very, very tiny little step in this long-term process we are facing. And I'm looking forward to further presentations here to learn more. And I'm thanking you for your attention.
Thank you. Thank you so much, Professor KNÖSS. Please be seated. Thank you.